COVID-19 by WHO has engulfed 2013 countries and union territories around the world. It is declared public health emergency of international concern on 30th January 2020 and as a pandemic on 11th March 2020. India is the only Asian country to be hard hit by the disease, second highest after USA. Now it is at the top so far as the daily detection of cases concerned. As on 21st September 2020, the total cases detected in our country is 54,47,807. Death toll is 87,299. Active cases 10,000. Sorry, 10 lakhs 9,369, and recovered cases are 43 lakhs 50,379. So the recovery rate is very encouraging. It is 77.15%, while the fatality rate is 1.61%. Regarding the spread of the disease in our state, the first case was detected in March 15th. It took 114 days to have 10,000 cases when the death toll was only 6. But within next 15 days, it became 20,000. And then only after 8 days, 10,000 more cases are added to it. So this shows the speed at which the disease is spreading in the state. So in the month of July only, the state has encountered 152 new deaths. Though the state has declared complete lockdown in hotspot districts like Ganjam, Khurda, Cuttack, Sundargarh, and weekend shutdowns in the districts where the positive cases crossed 100 mark. Till mid of the month of May, the government of Odisha was highly praised for its efficiency in containing the spread of the pandemic. But the things changed dramatically after 2 months. And the state is found outstripping Gujarat and Delhi in terms of Delhi report of confirmed cases. The mass influx of 8 lakh migrant workers from hotspot areas like Mumbai and Surat, many of whom did not follow either social distancing norms while traveling or government quarantine rules religiously, account for this increase in the cases mostly. The majority, that is around 4 lakh migrants, returned to Ganjam only, making it a corona hotspot in the state with highest number of patients as well as deaths. Though things are under control now. So as on 21st September 20, the total cases detected in our state is 1,79,880, out of which active cases are 33,451. Recovery goes far as to be 1,45,675 with a death toll of 701. It increased to 716, I think, yesterday. The recovery rate in our state is 80%. Of course, it is a better situation because people are recovering very fast. The table 1 here gives a comparative analysis of the cases in Odisha, India and world. As on July 31st, 2020, when we submitted the paper, so it shows that the world is having the infection up to 17 crores for 48 I mean 1 crore 74 lakhs and 83,692, while that is not that, according to that, state is not suffering much. So this is the district-wise confirmed cases, active cases, recovered and decreased cases as on 31st July 2020 in our state. As it is shown here, the Ganjam is having highest number of confirmed cases, that is up to 10,364, with active cases 3,134 and recovered 7,130 with death toll of 94. It is followed by Khurda with 4,200 cases. Now the number has increased much. So active cases 2,496 with recovery of 1,674 and death toll amounting to 22. Sonpur is the district where only 91 cases were detected and there was almost no death toll, uh, zero death is there. So this graph also represents the same thing, the confirmed cases, active cases, and recovery and death situation of the districts. So the figure here, the figure 3, represents a date-wise number of cases as on 31st July, starting from 15th March. So initially, as the graph shows, the increase in the cases was very slow, but suddenly it has taken speed, momentum, and it is increased very sharply up to 26th July. We have shown, and the figure 4 here is representing the age-wise COVID positive cases. So within 0 to 14 years of age, the infection was only 5%. Above 60 years also it is 5%. And 15 to 40 years it is 63%. And 41 to 60 years it is 27%. So very young mass is most affected. Everybody is telling that the old age people are more vulnerable, children are more vulnerable, but infection is more with the young mass. It is because these people are mostly going out for to purchase things or household requirements. Sometimes they also go to the fields to play, and other people are staying at home. That's why the infection is less there. And the third point, the initiatives by government of Odisha to combat the pandemic. Once the case is detected, Odisha, the state which is much praised for its disaster management, immediately came into action. And on 13th March 2020, it declared COVID-19 pandemic as a state disaster. On 18th March 2020, Odisha COVID-19 regulation is declared, and strict instruction is given to government and private hospitals to have a dedicated COVID isolation facilities. It started a dedicated COVID-19 helpline before nationwide lockdown was declared on March 24th. Also, government of Odisha inaugurated a COVID-19 portal and instructed all the migrants and the visitors to state to register in the portal mandatorily so that the government can trace their location and make arrangement for their quarantines. And 14 days quarantine in quarantine centers was also made mandatory. And on completion of quarantine days, an incentive of rupees 2,000 is given to migrants. It also opened up testing centers, 8 numbers at first, with a target to test 15,000 samples per day. On March 17th, newcomers to the prison are to be kept in isolation for 14 days and provision of e-mulakat was made. 2nd April is a very historic day for our state because on the day India's first COVID-19 hospital was established or got inaugurated in KIMS and Ashwini with 625 number of beds sponsored by Orissa Mining Corporation. Then free of cost testing and treatment is being provided since then. All the cost is borne by the state. Though the state is supposed to be a poor state, it is bearing all the cost of the testing, treatment and everything. Staff nurses, paramedics, house surgeons, PG students, also pharmacists are engaged in COVID care with special training and remuneration and diet allowance. ASA workers, ICDS employees are assigned the responsibility of door-to-door investigation and getting the suspects to testing centers. It also declared insurance of 50 lakh for doctors who succumbed to COVID-19 and later on extended financial assistance to family members who are not covered under the insurance. Now, at present, almost every district is having COVID care centers, COVID hospitals, test centers, though government has decided to close some of the TMCs with no occupancy. So to start with, we have to see what health infrastructure our state is having originally. This table presents a district-wise health infrastructure facilities available before the pandemic. So there are total hospitals, community health centers, primary health centers, mobile health units, sub-centers, and beds. As the table shows, in total, in Odisha, hospitals are 140, community health centers are 385 in numbers, primary health centers are 1274, mobile health units, those are moving to the rural areas to treat people, amount to only 199, sub-centers are 6688, and we are having only 18,387 beds. That's why whenever you go to any hospital.
Dr. Malik, you have just 2 minutes left. Yeah, please go on.
Okay, sir. Okay, sir. So our population is in crores, but we are having the facilities in thousands only. So this is a scarcity of the infrastructural facilities available to us. And this table shows the COVID hospitals in all the districts of the state. And in conclusion, I will say COVID-19 has put a huge challenge before every government. It has heavily affected the economic activities, be it agriculture, industry, or services sector. People are losing jobs, production has gone down, demand is adversely affected, schools are closed, and revenue collection has gone down while health expenditure has escalated. In Odisha, the coronavirus has huge adverse effect on health sector. Both the infrastructure and persons engaged in health sector are highly inadequate. With the current powerful engagement of a large number of health professionals and support staff to attend COVID-19 demands, patients suffering from other chronic diseases and other ailments are deprived of healthcare facilities. At present, the burden on hospitals is increasing. More numbers of being detected at COVID positive. Persons with less intense symptoms are asked for home isolation with medication following COVID treatment protocol with a view to reducing workload on the meager medical staff we are having. Now, as the state has started plasma treatment and human testing of vaccines, a ray of hope is there in the horizon. But to combat the menace, sincere participation of all the stakeholders like government officials, political leaders, people, civic societies is highly necessary. Above all, it is imperative that the state government increases the human power in health sector and have a broad-based improved health sector. With a poor record on health spending, it is not possible to face emergency health issues like a pandemic. Hence, it is suggested that the state should enhance the share of health expenditure at least up to 6%. This enhanced budgetary allocation would strengthen the public health system in the state. Thank you, sir.
Thank you, Dr. Malik. We listen to Professor Pulim Naik.
Okay, Dr. Malik, very nice paper. You've looked at all the broad elements of the COVID crisis, how the state is meeting the challenge. It is certainly the case that amongst all the major states of the country, Orissa has performed quite well, and in terms of looking at the pandemic, looking at the difficulty that people are facing, and how the state government has responded. And this has been recognized. There are a few other states which were recognized for their positive sort of response, but Orissa is certainly one of them. There are a few other states like Kerala and so forth, but Orissa has done very well. That's point number one. Point number two, however, is that there must have been some particular point at which you closed your analysis. But I think now, if you were to do the paper finally for us, you need to look at the data that has emerged subsequent to your analysis. I think another 3 months data would be available. So you can look at all of your tables, etc., and you can reformulate and give your
Yes, sir.
sort of broader analysis with a bigger time period under consideration. Number three, I think towards the end of your paper, you do mention that there has to be greater public expenditure on health, and I fully support that. I think India is a country where we are still in a very low expenditure proportionality as a fraction of state domestic product. It is somewhere, for the country at large, it's about 1.2 or 1.3% of GDP, public expenditure on health. Most states are more or less in that format. But I think it is time now that there has to be much greater public financing of basic health facilities all across the country, Orissa included. And finally, this thing, the COVID crisis has also brought up one difficulty, which is that most of the hard work is being done by the government hospitals when the government hospitals are short of funds. And when patients are going to the private hospitals, the charges are too much and people can't really afford it. So this is the real problem. So there has to be a much greater government participation in healthcare. And the COVID pandemic has again brought this particular point further to the fore. So the final conclusion, there has to be a much greater participation of the state in the health activities of Orissa. So these are my comments. I think you can improve your paper by looking at much more data that has emerged over the last 3 to 4 months. And that's all I have to say.
Sir. Thank you, sir.
Professor Mitra.
Yes. Let me begin by saying that, this information on COVID being available plenty doesn't mean that we present those information and claim that we are writing about public health challenge in the state. Now, what is missing in this paper is that when we talk about, like any emergency, any disease outbreak can pose a challenge to any system. That's a fact. But when you want to write a paper on public health challenge, it's not merely the infrastructure challenge that is important. That is what, because the data availability is very much there. So you can see the discrepancy, you can have a district-wide, you have a disaggregated pattern of analysis, and you can find out that there is a kind of a discrepancy which can pose a challenge. To me, it seems that public health challenge is not limited to merely the provisioning of infrastructure or treatment, but what it involves also is that in a state like Odisha, your hygiene, sanitation, your all kinds of shortcomings which happens in usual living can make people vulnerable more. And I find that when you tell a title public health challenge, you have to have some dimensions which are more important beyond, it is about care provisioning or treatment provisioning for a particular outbreak. This is first thing that you must add up, because if you don't add up, then you are not able to make any claim that what exactly is the challenge to the current circumstance in Odisha when COVID came as a surprise. My second comment will be that, you have come to a conclusion after showing few tables which are available, which are not very difficult to collate and put together. As Professor Naik rightly told, that you can update them and you might get a very fresh scenario pattern. But the conclusions that you are deriving, that, one conclusion for which I need some evidence, because I have been hearing it from many, I can read it in newspaper also, because of the focus on COVID, the alternative treatments for all other diseases are perhaps lacking. People are not able to get treatment. For instance, people are not able to get dialysis, people are not able to get chronic care, all these things, and there can be fatality arising out of that. But you have to have some evidence. It's not like a kind of a guess that everybody is talking about that and you also make a conclusion, because often in a research paper, don't derive such conclusions without an evidence. You have to show some evidence as to why it is and where it is. And one of the most important missing point in this paper that I find is that, when we talk about, there is in the state no public health cadre. You look at the state of Tamil Nadu, you have a public health cadre. So in the health, there has to be a public health cadre which facilitates. Because, for instance, in Tamil Nadu, addressing chikungunya, addressing dengue, they have a public health cadre personnel who actually do the job. And this should be a learning point for the state, that the state does not have a public health cadre and brought together everybody, including starting from ASA worker to ICDS personnel to the administrative police station to the collector, to have an emergency that you better. Okay, fine. You can do that on one instance, but you can't continue to do this, because this is going to be an emerging problem of tomorrow as well. So you should be able to say that what is the public health cadre in Odisha. And third, and the final thing I would say, that this COVID-19, and when you talk about public health challenge, I would like you to highlight somewhere that the database generated on health in the state, including the health management information system, including the ICDS, including everything else, how much of that actually fits into policy in the state? That is absolutely not there. So perhaps COVID-19 is an occasion to harp on this fact that you have these information, and and that's what as a researcher you must say, because these are all information available with the government. Many of them are in public domain, many of them are not. I don't know the reason why not. But that should awaken the state, that health information available, and this is an opportunity for researchers to harp on it, saying that you better, and this should lead, this should show the way as to how do we analyze public health related health, child nutrition, child sickness, maternity, you can have about old age disease, chronic disease, lot of surveillance information which has been obtained in the name of COVID. In fact, now you have a survey of information in households where actually you know that there is there is a whole scale of information in rural areas which is obtained, and why that information cannot feed into policy. So, two parts of revision in your paper I want. A, update all the information on the availability, which is the much easier job. Second, B, the conclusion that you are talking about, how does differential infrastructure, existing infrastructure, has really triggered the spread of the pandemic, and its alternative treatment provisioning, which you told has suffered. And third and most important is that will this be an occasion or an opportunity for the state to start making a public health cadre, because COVID is not an isolated one. Tomorrow we can have few more. So perhaps you should focus on that. Then that paper will sound like you are talking of public health challenge. Don't tabulate existing information and claim that you have a paper on public health challenge. So hopefully I am pretty critical, but I think this will definitely add up the paper and make it better. Thank you.
Thank you, Professor Mishra, for
Thank you,
this
sir.
very
Well done.
detailed and useful comment. Amarendra, you would like to make one or two small points?
No, I think Mr. Sir has made very detailed comments. I think I will not have to add anything more.
Any other participant wants to say something quickly? Maybe we have 2-3 minutes. And any participants wish to make any comments on this paper, please? I think both Professor Naik and Professor Misra have given very useful and I thought extremely detailed, helpful comments. In fact, my only one or two very small points. I thought, I mean, as they have sort of indicated, I thought it's a very descriptive paper based on very ordinary compilation of data, which I'm told that available on the state COVID dashboard, for instance. So what is the value addition? And that's my first question. And the second thing relates to the conclusions, particularly like the case for enhancing, let's say, the state share of expenditure on health. Is it something which is flowing from the presentation, or is it something which is flowing from the analysis? That is the point. That may be an interesting or important recommendation or suggestion at the end of the paper. But if it is not backed by the analysis provided in the paper, I think that may be misplaced in terms of the focus of the paper. And one more thing which I thought she probably could have tried, or both of them, both the authors could have tried, relates to the role of the non-state actors. If you are talking about health, and as Professor Misra did mention, that there are a variety of issues which are sort of falling beyond medical care. I mean, sort of something to do with, for instance, he was making a reference to availability of sanitation, awareness about certain health practices, for instance, health behavior, for instance. So whether the non-state actors, the civil society, if you like, have they played some special role during this crisis in terms of supporting the state and also in terms of doing independent work in specific regions to sort of address this question of sort of non-medical, but then more sort of behavioral issues related to health. I thought these were some of the points I wanted to make. And one last thing was, maybe even if you are talking about the health infrastructure, maybe you could have gone one step ahead and talked in terms of what kind of facilities. Like, for instance, what is the number of ventilators available, for instance, whether there is a regional variation within the state, intra-regional variation in terms of provision of certain kinds of health facilities. Maybe some of that would be helpful. So those are my points. So Dr. Malik, you can have 1 minute or 1.5 minutes to respond if you like, please.
Sir, actually, I have shown that there is a less infrastructure available. So that is why that inadequacy is putting the problem. And if we shall increase the government expenditure on that, the public expenditure can address that issue. That is what I wanted to show up there. And about that suffering of the common people, those who are having other diseases other than COVID-19, I have, of course, I don't have any data, but I have talked to the medical people, the doctors. They are admitting it. They are not able to provide the service. But I have not collected the.
Maybe on this particular point, you might be able to get some data today, now, as compared to when you wrote your paper. On the non-COVID patients who are denied medical care and having difficulty. If you can obtain some data, it will be useful. That will be useful. Earlier on, you could not get, but maybe now, if you try hard, you might be able to get data. Of course, everything you have to do within 10 days or 2 weeks.
So I don't know whether it's possible or not, because we are very much afraid of going hospitals and collecting data.
You do your best. You do your best. Try to get the most up-to-date information, please.
Yeah. Okay, sir. Thank you for your
Okay,
suggestion.
thank you, Dr. Malik. So we move on to the next paper by Dr. Kavita Kumari Sahu. That is
So,
on
so Professor Das, now we are having looking at the papers for today originally
exactly,
scheduled. Right?
exactly, sir.
The paper
Exactly.
just finished was yesterday's schedule. Wasn't yesterday's schedule?
That's right, sir. So in fact, today may be kind of a longest day because there are altogether 10 papers and one is over. But we are sort
Now,
of on
now
track.
there'll be 9 papers, right? Now there'll be 9 papers.
That,
Yes.
that's right. So, Dr. Kavita Kumari Sahu on COVID-19, MSMEs and policy priorities in India. Please,
Okay,
you
sir.
have 15 minutes.
Okay, sir. Namaskar, Madam. Namaskar, sir. Good morning to one and all present here. Respected Spulin sir, respected Keshav sir, Uday sir, and respected Amarendra sir, and my respected colleague Minati madam, and other respected participants. It's a great pleasure on my part to present a paper in this unique academic forum which creates history in Odisha Economics Association. And the title of my paper is COVID-19 MSMEs and Public Priorities in India. Now I am going to share my screen. Sir, is it visible, sir?
Yes, it is. Yes,
Sir, is
it is visible.
okay. The COVID-19 pandemic has become one of the biggest threats to the global economy. And it is the greatest challenge, I think, of our time. So this outbreak has brought the considerable human sufferings and major economic disruption, no doubt. The government of India has taken all welcome steps, all necessary steps, and so many initiatives to face the challenges posed by the growing pandemic of COVID 19. But we can't ignore the impact of the COVID 19 on highly vibrant and dynamic sector of the Indian economy and the growth engine of the nation, that is the MSME sector, which is the second largest job provider after agriculture. No doubt, the COVID-19 has broken the back of the MSME sector and has taken away the livelihood of the millions of the people of our country. A study carried out by International Labour Organization which states that the 24.7 million workers are losing jobs in MSME sector. And that report also doubts about the sustainability of business operations of MSMEs. So in this context, the objectives of my paper are to analyze the impact of COVID-19 on business of MSMEs in India and to highlight the policy measures and subsequent efforts to rebuild the MSME. And my paper is based on purely secondary information, and to be very frank, it is purely descriptive in nature. Since COVID-19, that is the recent problem of 6 to 7 months, it is very difficult on my part to quantify the impact of pandemic on MSMEs in India. No doubt, the Office of Minister of MSME, Government of India, are currently conducting survey on this the particular topic, and data will be released very soon. But till today, data are not yet published. Let me explain the significance of MSME in Indian economy. The MSMEs are playing significant role and they are considered as the backbone of the Indian economy. Due to the, in terms of output, in terms of employment generation, and in terms of exports. This sector contributes 30% of GDP and 31% of gross value added. According to the annual report of MSME 2018-19, it clearly shows that there are about 63.38 million enterprises in MSME sectors, and out of which 31% are engaged in manufacturing activities, 36% in trade, and 33% in other services. And this sector employs 111 million workers, which is almost 21% of the total employment. And this sector also plays a key role in India's export basket. And it is interesting to note that the 12.5% MSMEs are owned by the scheduled caste, 4.1% by scheduled tribe, and 49.7% by other backward classes. And almost 14% of MSMEs are women-led enterprises, and 60% of MSMEs are established in the rural areas. And MSMEs are mostly concentrated in 7 Indian states, that is UP, West Bengal, Maharashtra, Bihar, that is Tamil Nadu, Andhra Pradesh, and Karnataka. And this table clearly shows that the share of the MSME in various sectors, that is the manufacturing sector, trade, and other services. And now I want to explain what is the role played by the MSMEs in our dearest state, Odisha. That is there are 3.91 lakhs MSMEs are operating in Odisha with an investment of 19,000 crore rupees and employment of 15 lakh workers. Due to the current pandemic, we all expected that the MSME sector will solve the acute problems from our state, that is the unemployment, poverty, and displacement. But it is sorry to say that this sector is seriously affected by COVID-19. So the government should take care of it, and government should create a conducive atmosphere to promote the business environment and employment to ensure the livelihood of the people. Now over to impact of the COVID-19. After the outbreak of the coronavirus, 25% of MSMEs are shut down due to the shortage of the raw materials, labor, and working capital. It is estimated that 24.7 million workers lost their jobs, and there was a shortfall of 44.7% revenue. Except pharmaceutical products, MSMEs have completely stopped their export due to the lack of global demand, closure of the borders, cancellation of order, and delays in shipment. And they are also most affected due to the lack of timely availability of the cash and the labor. And loans are also not available from banks due to the lack of the collateral security. Due to the demand side constraints and supply side constraints, most of the MSMEs, they are unable to pay rent, electric bills, wages of the laborers, interest and loans, and other obligations. Though central government has removed the restrictions on the movement of the people and the raw materials, most of the state governments, they have put the restriction on the movement of the people and raw materials. That will continue for a longer period of time. I think the MSMEs will cease to exist and they will stop their operation. According to a survey of Government of India, that only 7% firms in manufacturing will be able to survive because they are already under the huge stress due to the demonetization, implementation of GST, and finally the biggest of all, that is the COVID-19, which has aggravated the crisis in this sector. And a survey conducted by All India Manufacturers Organization covering of 5,000 MSME found that 71% of business could not able to pay salaries to their workers in March 2020. COVID-19, that has also affected the import of the raw materials, which affect the supply chain of the MSME sector. So the pandemic has taken away the livelihood of the millions of the people in our state and also in our country. And this slide shows that the revised classification by the government, which has recently announced on 26 June 2020, and according to this new classification, the micro enterprise that has been classified, that has been defined, that where the investment in plant, in machinery or equipment does not exceed 1 crore rupees and turnover does not exceed the 5 crore rupees. And small enterprise, where the investment in plant and machinery or equipment does not exceed 10 crore rupees and turnover does not exceed 50 crore rupees. And the medium enterprise, where the investment in plant and machinery or equipment does not exceed the 50 crore rupees and turnover does not exceed 250 crore rupees. And the basic motto behind this revised classification of the government is to include more and more industries under MSME so that the industries can reap the financial benefits which are extended to MSMEs. Due to the reclassification of MSME units, more industries are able to get the COVID emergency loan, which is highly essential for their revival and for their survival. For example, if an industry has availed the rupees 10 crore credit facility on and before 29 February 2020, they are eligible to get additional credit of rupees 2 crore for revival. and for revival, and they can avail such type of loan without the collateral security supported by the government guarantee. Now over to policy response from Government of India. The Government of India is quite attentive and quite serious to this pandemic. Regarding the government initiatives towards the MSME for the revival, it can be classified into two categories, that is financial support and preferential tax policies. Most of the measures by the government are only meant to ease the liquidity constraints, and these include the deferral of interest payment, loan installments. RBI has also instructed the SIDBI, NABARD and NHB to lend MSMEs at the lower rate of interest against collateral security. And against the extension of the moratorium period and the provision of 20,000 crore as subordinate debt for stressed MSMEs for the period of 7 years, and the ban of the global tenders, that is to make the more self-reliant to the MSMEs, which are the other welcome steps by the Government of India. And another liquidity instructions that is also by the government, that is the pending of tax refunds to be issued immediately for both employer and employee contributions for employees provident fund, that is to be paid by the government, filing of the GST returns without interest, without late fee, without penalty, and reduction in repo rate, that is also by the RBI only to support the MSMEs in our country. And another remarkable step by the Government of India is that the announcement of the Atmanirbhar Bharat Abhijan, which intends to address the needs of the MSME sector and paves a path for the long-term sustainability and profitability of MSME. Another also Yojana, that is the Pradhan Mantri Garib Kalyan Yojana, which also addressed the problems of the MSME sector, and aim is to help the MSME sector. To support the startup units in our country, and in form of equity capital, government has also started funds of funds, and it is also a very important initiative by the Government of India for the revival of the MSME sector. So in this context, my paper also highlights some amicable suggestions to revive MSMEs. Since the micro enterprises predominantly operate on cash, the immediate requirement is to provide adequate liquidity to cope with the uncertainty. So there is a need of the sector-specific packages for those sectors which are most affected by pandemic, like tourism, hotel, transportation, construction, etc., so that they can get more relief. And there is also need of the special package for the labor-intensive sectors such as garments, footwear, gems, and jewelry to survive. And employment provident fund and employer state insurance corporation waivers, that should be extended for more period, so that they will not lose their claims for buyers and will be regarded as the reliable business partners. To improve the competitiveness of the MSMEs, digitalization of MSMEs is highly essential. So high-speed broadband connectivity, especially in rural areas, is required as the long-term policy measures. There is also need of the database for the migrant workers at panchayat levels. A system should be created for the registration of the every migrant worker, so that it will be easy for the government to rehabilitate them and to extend the benefits. And establishment of the purpose fund and emergency fund is highly essential to facilitate the MSMEs. Since many farms are operated by women, so a comprehensive and special package should be provided by the government to women so that they can easily access the credit facility. And wage subsidy to those businesses which are facing revenue decline should be provided. So wage subsidy that should be transferred, that amount should be transferred directly to the account of the workers. Further, to promote startup, it is necessary to enhance the amount of the Shishu scheme under Mudra Yojana.
Dr. Sahu,
Okay.
maybe just 2 minutes maximum.
Okay, sir. Okay, sir. That should be enhanced to 1.5 lakhs or 2 lakhs from the current level of 50,000, which will benefit the micro segment. And farms engaged in the exports, they are also suffering due to the collapse of the global demand. So a special package should be given. It is highly essential. And pre and post shipment credit is essential for at least 1 year to the farms engaged in the exports. And last, my suggestion is that is the e-market linkage for MSMEs, that should be promoted for the products of the MSMEs. And that should be, it must be clear by the government whether that linkage to be government e-marketplace or to the private platform such as Amazon or Flipkart, and how this linkage will work, that should be also clearly defined by the government. And to conclude, there is an urgent need for the allocation of the robust fiscal package to revive the confidence of the MSME sector. No doubt government alone cannot do anything. There is also need of the concentrated effort, action and effective implementation of the policies by the government to revive the MSME sectors. Since India is a hub of trade and investment, it is necessary to first help our domestic firms and strengthen their productive network to harness their inner potential so that they will be in a better position during this crisis. And they can enjoy the fruits of the government policies. That's all. Thank you all for patient hearing. Now I stop my screen sharing.
Thank you, Dr. Sahu, for making a good presentation. So now we'll have comments. Dr. Naik, please.
Yeah. So, Dr. Sahu, very nice paper, very well presented. Let me begin by saying that I think, again, you will be able to look at some additional data that may have emerged over the last 3 months or so to further bolster some of your conclusions. That's point number one. Point number two, I would have thought that, when you look at the MSME sector, correct me if I'm wrong, and I think Professor Keshav Das, who will come at the very end and he's chairing it, he has done a lot of work on MSME, so I'm sure he'll have certain things to say. But what the point I want to make is the following. Within the MSME sector, I understand that most of the units actually fall in micro, in the very first micro, small and medium sectors we are looking at. Essentially, more than 90% are coming within the micro sector. So, the overwhelming majority of the MSME sector come within the micro sector. So we need to focus on what are the kinds of problems that the micro sector actually faces. Because when we move to the medium sectors, as you yourself have said, now the investment limit has been pushed up to 50 crores, which is very high for a state like Orissa, and the turnover is 250 crores, which is pretty high. And most of the MSME sectors actually are within the micro sector, more than 90% within the micro sector. So we need to put a little more focus on this particular sector. My second comment would be, in your paper, you do some part of your analysis which looks at the broad Indian data, and some part of your analysis that is looking at Orissa. I think it would be desirable and good if you were to distinguish the broad conclusions, data and conclusions that you get from the Indian data and the ones that you are able to obtain from the Orissa data. And if there is some sort of conclusion that is similar between the country at large and the individual state Orissa, that would be useful. If there are some differences that you are able to see, if Orissa is doing certain things in a better way, more sympathetic way towards the micro sector or the small sector, those points need to be brought out. And the final thing, I think your broad conclusion that the MSME sector really has to be helped, it goes without saying, because we are at a point in our country's development where the agriculture sector, the share of income originating in agriculture has gone down to about 15 to 17%. But the population engaged in agriculture still continues to be close to about 50 or 55%. And our hope really lies in shifting this population to some kind of industrial activity. And which industrial activity? Obviously, the MSME sector is the key sector that is likely to absorb the labor and beat a kind of Lewisian kind of model where you shift your agricultural laborers into small scale industrial units. So MSME sector is the key sector that is likely to be the sponge which takes labor from agriculture, and thereby we can think in terms of expanding our employment base and so forth. But all of this is not happening. The COVID has given a very strong negative jolt to the economy. First quarter GDP has gone down as much as 24%, and by a long margin, the MSME sector is the one that has been hit the most. So, what is the most that can actually be done for the MSME sector? Need to focus on. You've already done that, but you could bolster some of your conclusions by looking at data for the next 3 to 4 months. Thank you. That's all I have to say.
Thank you, sir.
Professor Misra, please. Professor Misra. Professor Uday Misra is not there.
Yeah.
Yes, sir, please.
Yes, Professor Das. Yes. And well, let me say that I'm not technically competent to comment on this paper at length, but still, when it comes to COVID and COVID-related exigencies and a particular sector of the economy, when I listen to you, what I feel is that you have weighed too much about vulnerability of the MSME sector, and that's what natural because of the fact that the sector is vulnerable as regard employment and other issues which you have highlighted pretty well. I would like just one comment that strengthening this connection, that what are the kind of COVID related, it is not merely just lockdown, but also COVID related changes that happen in the market demand, for instance, in the entire consumption spectrum. Those linkages are also very important to connect, because it's a MSME sector's typical vulnerabilities apart. These have added to those vulnerabilities, and what government has done, the measures adopted are a financial package. A financial package or an incentivization is not sufficient unless the aspect that is to be diagnosed as to what other vulnerabilities can come for the MSME sector to function itself. So when you link, one of the things that you can do, which I felt that there is a gap, as regard COVID-19, the kind of consequential measures which came and consequential things which came in with relation to the market would be very important to connect MSME sector's vulnerability with COVID-19. Otherwise, as a sector, it's an emergent situation which has come up. You have dealt with it pretty well. So this connection, if you do, then the paper will be more reading for a person who wants to see how does COVID-19 affect them. But otherwise, I don't have much to say. Thank you.
Thank you. Thank you, sir.
Okay. Amarendra, you would like to make any point? Amarendra? Okay, maybe he'll come back. Any other participant wants to make any formal points, please? Any comments, suggestions from other participants? Okay, so I was just thinking, I think some of the very interesting points have been made by both Professor Naik and Professor Misra. I think very interesting observations they have made. So I have a little issue with, as I think largely what Professor Misra suggested, that how you link this MSMEs to the COVID crisis. I think that is, it's not actually the MSME. So there are two things. One is there are certain pre-existing vulnerabilities of this sector all these decades. So this is a sector which has not always achieved the best of support from the state over the decades. So with that vulnerability, you have an added crisis like COVID, which has really sort of hit hard in an otherwise very predominantly informal setting. So I think that is one part probably you did not mention, that this whole overwhelming presence of informality which makes this sector very vulnerable. And the other point which Professor Naik did mention, that this is essentially, though we are calling it as MSM, that is micro, small and medium, it is in several states more than 90 to 95%, even in Odisha, it's more than 97% of uh, more than 90% units belong to what is known as the micro enterprises. And within that, there is more than about 55% of these units belong to the rural areas. So I think you cannot actually make a sort of kind of a study of this sector at the all India level without recognizing this overwhelming presence of informality, overwhelming presence of very micro units, and also a large presence of rural units. I think it is in this broad context that you have to really think in terms of what suggestions you need to make. And the other thing relates to very COVID specific issue, relates to what kind of like what happened to workers. I mean, all the packages that we are talking about, you mentioned Atmanirbhar and varieties of packs. So this kind of support systems have always been there, and most often this is the formal sector, that is the enterprises who are registered enterprises. They are the ones who have often taken advantage of it. And now with the enhanced, whatever the new definition that you presented, through that we know that these are the relatively larger of the so-called MSME. They are the ones who are going to take a lot of benefit. So I would rather think you please make some comments on the informality part. You make some comments about the workers, what happened to the workers during this crisis. And one more thing, which again Professor Naik mentioned, that when you just sort of you give a glance of the Odisha thing, I think you have to justify why you are talking about Odisha. Are you, if it is a study on India, so why to give a little one sort of little view of Odisha's situation, unless we are making a kind of a case of that or to making a specific study.
Thank,
So these are some of my points. And if
thank you,
Amarendra
sir.
wants to say something, please. Amarendra or anyone else, quickly, we still have about 3 minutes. Otherwise, Dr. Sahu, you can probably take about 1 or 2 minutes to say what you want.
Thank you, sir. I will take care of your observations and also suggestions, and I will incorporate all suggestions and all observations in my paper. Then I will, so that will improve the quality of my paper. Then I will resubmit my paper to the Odisha Economics Association. Thank you, sir. Thank you, sir.
Thank you, Dr. Sahu. I think we move on to the next paper by Dr. Ketki Kumar. That paper is on E-Vidya program in KBK district of Odisha, a commitment or a gimmick. Please, Dr. Ketki Kumari, Dr. Ketki Kumari. Yeah.
सर मोर एक्चुअली कंप्यूटर हैंग हेगला तो मु आपन सुनिली कि न किछ कहि पारलिनी मैं से
अच्छा,
मोबाइल आ कंप्यूटर रिस्टार्ट करछि बट एनी आई डिड नॉट हैव एनी कमेंट्स टू गिव सो दैट इज फाइन
Okay.
मैं
Sir, am I
कंप्यूटर
audible?
Yes, you are audible. Yes, please. Yeah.
So my PPT is visible?
It's visible.
Yes.
Yeah.
yes it is
Yeah. You have 15 minutes, please.
Good morning to one and all. Myself, Ketki Kumari, a research scholar from Central University of Karnataka. I will be presenting on E-Vidya program in KBK districts of Odisha, a commitment or a gimmick. Education is a basic human right and builds human capital. If improvements are faster among disadvantaged groups, then the growth will reduce the poverty and several deprivations. Education promotes economic growth and creates the building blocks for inclusive institutions. In 2000, at United Nations General Assembly, 189 nations promised to reduce poverty and several areas of deprivations, which came to be known as Millennium Development Goals. Again, this got replaced by Sustainable Development Goals, and it was adopted in 2015. to protect the people from poverty and ensure peace and prosperity by 2030. And the fourth goal of SDG is to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. And in India has also made progress in achieving universalizing primary education. It has introduced right to free and compulsory education act. And again, the country also has few people belonging to certain caste who undergo social stigma and social and economic backwardness, who are called scheduled caste and scheduled tribes as per Article 341 and 342. There is nothing new for the marginalized sections, as the pre-pandemic situation was bad and the COVID-19 pandemic made it worse. This COVID-19 has made the situation more worse for those who were already vulnerable to economic and social inequalities and who have historically remained marginalized and were discriminated in the society. COVID-19 pandemic is a health crisis and many countries have decided to close schools, colleges and universities. India also decided the same. And to bridge the gap of education, the teachers are requested to take online classes. The Prime Minister Narendra Modi on May 12 announced Atmanirbhar Bharat Abhiyan. The sole objective is to make the nation self-reliant and help the people to tackle the situation. And in the fifth phase of Atmanirbhar, online education during COVID-19 has been discussed, which will take place through Swayamprabha DTH channels and Diksha platform. The study area discussed in this paper is Odisha, especially focusing on KBK districts of Odisha, which shows high population of scheduled caste and scheduled tribes, and it shows less literacy and low educational attainment. So few of the papers which I have reviewed, it shows that there is an interlinkage among the lack of education, deprivation of poverty, caste and gender divides in a society, and due to poverty, scheduled tribes cannot afford basic household amenities and lack education, healthcare, employment, social development, and access to basic household amenities. The widespread poverty, poor living conditions, and high illiteracy has made their conditions more vulnerable. To achieve literacy among the marginalized, the state should provide minimum basic facility. Major dropout is due to the lack of resources. KBK, among the 8 KBK districts of district, 5 district comes in the southern region of the state: Koraput, Malkangiri, Rayagada, Kalahandi and Nabrangpur districts. And according to Odisha Human Development Report, southern region has increased, poverty has increased in the southern region. And loss for online education, they're like not having a smartphone. A student from an economically weaker section studying in class 10 committed suicide in Assam. Then Sibani Kumari, a student of West Bengal, also committed suicide. Then again, a Dalit girl from Kerala, Devika, she also committed suicide. Then Odisha during COVID-19, Odisha government has planned to adopt online education for class 10 students. Government schools were lacking for infrastructure for which online education could not be imparted, whereas the private institutions started imparting online education. Only 5% of students in Odisha have access to computers with internet connection, whereas in rural areas it is 2%. The objective of the paper is to evaluate the population distribution of rural and urban areas in KBK districts, to examine the literacy rate and educational attainment in KBK districts and its distribution by marginalized section. It examines the excess of resources for online education to become self-reliant, that is Atmanirbhar, in the KBK districts of Orissa. It suggests means and ways to tackle the situation during COVID-19 in the KBK districts. Overview of distribution in KBK districts, like population distribution. As we see, like most of the population are high in rural areas with respect to the state population, and And here also, like we see that with respect to the total population of the district, more population are residing in the rural areas, and most of them are scheduled caste and scheduled tribes. And now the educational status in KBK districts, literacy rate, coming to the literacy rate, like Nabrangpur, Malkangiri, Koraput, then Raigada, Nuapada, and Kalahandi, like these are the most like showing less literacy rate. Only Subarnapur and Balangir are showing relatively better. And literacy rate of rural and urban area, in the rural area it is like comparatively they are less, and in the urban area it is little better comparatively. And this is the rural educational attainment. uh, Rural educational attainment, as we can see, like Subarnapur performs little bit better, it is having 4.71, and others are having around 1 and 2% only, like 1 and 2 years only, uh, like 2 years 3 years, like having and then for urban education also, it's like comparatively better as compared with the rural education attainment. And the basic amenities available for online education, main source of lighting, as we see for the lighting also, like rural areas are lagging behind as compared to the urban areas. Rural and then villages declared electrified, like villages are also total population having electricity in percent. And this is the ownership of landline or mobile phones in KBK districts. Mobiles then again having landline. And this is the rural one, where we find that in the rural areas people are having like not having landline and all is more, and in the urban areas it is comparatively better. And then again, going for the television also, like how many people, how many households are having television. In the rural areas, people are like comparatively people are having less as compared to urban. Then this is the like households having computer or laptop with internet and without internet. With internet, the percentage is very less among the rural areas, and among the urban areas also it is less, but it is comparatively better than the rural areas. Then coming to the conclusion, the pre-pandemic educational status of KBK districts of Orissa was far away from the state literacy and educational attainment. Among the scheduled caste and scheduled tribes, the scheduled tribes perform worst, especially in the rural areas. The high population proportion in the rural areas and the high presentation of scheduled caste and scheduled tribes indicates for a development of rural economy. The individuals do not have sufficient amenities like mobile phones, laptop, internet connection, and a television at home, and also lack electricity facility in the KBK districts of Odisha. The rural area people lag behind in having these amenities. The suggestions not having the basic facilities for the online education is an indication towards a failure of e-Vidya program in the KBK districts of Odisha. Hence, it is the responsibility of the government to take steps wisely for these backward districts and save the people from the big loss. The government can make use of loudspeakers where high number of students reside. This model was basically used by one of the headmaster from Jharkhand, which turned to be successful. On June 29, the Union Human Resource Development Ministry announced to spend 60,000 crore rupees to provide digital devices for over next 5 years. So this initiative should also be focused on KBK districts of Odisha. The government should provide, distribute free laptops and smartphones to the students. It should also provide data package or a minimum amount to the students for the use of data package. The households which do not have a television should also be provided the same so that they can connect to Swayamprava DTH channels and Diksha platforms. Thank you.
Thank you, Dr. Kumari. We listen to Professor Naik comments, please. Professor Naik.
I've just unmuted.
Okay, sir.
Thank you, Dr. Ketki Kumari, for your presentation. We are looking at a very deprived segment of the country, and also within Orissa, a very deprived segment of the state of Orissa, which is the KBK district, Kalahandi, Balangir, and Koraput districts. Are you able to hear me, please? You can hear me?
Yes, sir. Yes, sir.
Yes. Yeah. So, when we look at the issue of education, your focus seems to be on e-connectivity and so forth. And much of the discussion is in the form of whether students have electricity, whether internet connectivity is there or not. And I'm just quoting your numbers that only 5% of people in these three districts have computers, only 2% in rural areas. Now, if that be the case, what is the kind of reliability or reliance we can put on this mode of education? So what I want to say is something very basic and very simple. We need education at the most basic level in these parts of Orissa, which is instead of having the hi-fi reliability on computers and internet connectivity and so forth and so on. Of course, right now, COVID has led to a situation where schools are closed and so forth. But surely that is going to change, and children are going to go to schools. And once they go to schools, what I'm trying to suggest is that we need education at the most basic level. They need books, pencil, pen, notebooks are needed rather than computers and immediately getting onto online kind of teaching. So what I'm trying to say is that in a particularly deprived part of the country and the state of Orissa, where incomes are very low, people are deprived, a lot of SC/ST community is there. There are very few modes of having employment for themselves, very low level of earning, major, the poverty population is very high. In this kind of a situation, to think in terms of our focus of education to be on internet is, I think, misplaced. We need to give basic books and basic education, making use of blackboards and chalk is what I'm really talking about. We need to develop these young children to learn the basics of arithmetic, literature, and numbers and so forth, and not go into the very hi-fi modes of teaching. So this is what I feel ought to be the principal focus. And of course, you are giving a lot of descriptive part of whether the e-Vidya program has been a success or not. Obviously, there are strong areas where we are falling short, but I think that is partly because we are thinking of the education process in a completely wrong kind of format. So this is my view, and my view is to think in terms of education in the most basic format before we get on to internet and the hi-fi kind of formats. Thank you.
Professor Misra, Professor Misra, if you could please.
Yeah. Let me make an observation that when we compare COVID-related vulnerability and examine in a vulnerable segment of the population, that is KBK, my comments to this paper will be somewhat in relation to not taking this macro scenario, which is obviously a kind of a setting that entire state of Odisha is that way, not equipped to have education functioning with the e-based, what we say, like e-based functioning of catering to education. Even though it is a fact that you want to highlight that, and perhaps that is important, that COVID has given a circumstance to highlight that how such disparities prevail, and these disparities in times of emergencies like this can widen the kind of privileges that people have and the deprivation that people have. In fact, before COVID, I was analyzing the Odisha information base with relation to when we talk about not e-education, but all this what is called internet innovation based education, which is available. And in fact, the basic infrastructure that is required to benefit from it in Odisha household, as you have rightly stated somewhere in your presentation, that 7% of the household or 5% of the household in all. Now, I don't think that accessing this is more important, but I would say that this is the way to look at education relationship in a very direct manner as COVID affects. But what I would be interested, if you can do it, that what is the indirect effect? Because fact is that COVID-19 has definitely brought in employment and livelihood related vulnerability. And that almost all international organizations are now talking about how is it going to affect education. For instance, dropout. For instance, children not going to school. Girl children in particular will be deprived of basic education. So in a vulnerable setting, when not about whether they have access to e-vidya and all that what we are talking about, but you should also be able to highlight that these households will stop whatever we were doing from three perspectives. One was that the entire incentivization scheme for making children come to school will get affected because the schools are not open. Second is that livelihood related vulnerability will first curtail the fact that the children who are supposed to be in school or in education will be discontinued. And that needs to be talked more when it comes to COVID and education. If you take it directly, the intervening strategy that is adopted and it is not going to work, yes, it is not going to work because there is no infrastructure. And overnight, you don't attain gains in infrastructure that everything will become as usual business. So this is one thing which you can add up if you can have some information of this kind, that how livelihood related, employment related vulnerability will actually do damage to continuing education, especially in this region. My second observation is that which is slightly different, as to even if you are talking of infrastructure, there is no assessment made as regard whether there is a familiarity with the providers of education in relation to this. We are talking of not higher education. We are talking of school education. In school education, are the education providers are equipped enough? That we are not talking of. We are talking of, infrastructure is not there and all that. But if that is itself not there, then this is a dream. I mean, this is just a dream that we feel that it can be materialized. So these are two aspects of things which needs to be highlighted rather than the direct impact that you don't have access. And if you want to write about educational impact of COVID in a macro sense, I would say that COVID will have an impact which will only be known after the generation. Because you must understand, education once lost, it cannot be regained. So in about 5 to 10 years time, we will know that a cohort of people who have been deprived of education. So this will not be known now, but it will be known later. So I think if you're writing an article on education related to COVID, highlighting this is much more pertinent and relevant, because you must say that losing out will not even be known, because nobody will assess it now, but it will be known at a later point of time. Otherwise, I think highlighting this is a very relevant, and it's important that we should talk and we should have a paper on educational impact of COVID. Thank you.
Thank you, Professor. Amarendra, you would like to make any comment?
Yes. Again, the title of the paper is E-Vidya program in KBK districts. Okay. So, two things. One is that whether you are focusing on the E-Vidya program and or you are focusing on the KBK district, or you are focusing on the both. That how is the E-Vidya program going on in the KBK districts? Now, coming to the COVID, since this is a special issue on COVID, I was basically thinking that you will be speaking on the education scenario in KBK district during this COVID-19. And probably you have missed all those points because if you, no, I don't know whether you are now in Odisha or in Karnataka, but since I am here actually in Bhubaneswar, I am following actually how the online education is going on in Odisha, particularly at school level, at college level, and at university level. And at school level, now the education is being imparted through WhatsApp. Particularly, I'm talking about the government schools in Odisha. Now, the teacher is sending the teaching notes to the parents of the students who have enrolled in those schools. And similarly, in some other schools, also some teachers are making a video of the content, and then those are sent to the WhatsApp numbers of the parents of those children. So they have formed different groups, and that's how the study materials are being sent. Now, so I was basically thinking that you might have probably done some study in the KBK district and evaluated how this online education is going on in those KBK districts. Because in fact, in the KBK district, there is a different challenge that we are facing. The teachers who are appointed in the KBK districts are mostly not from the locality. Mostly I'm telling. Most of the teachers are from the coastal districts, and they have been recruited there because of the percentage of mark. So they have got good scores and they have got a chance to join in those schools. Now during the lockdown, most of the teachers were present in the coastal, in their hometown or in their home villages. So they were not present in those. I'm not telling that none of them were present, but many actually were not present in the schools. And in fact, that is also the reason why the salary of many teachers have been stopped. The BEO, Block Education Officer, has stopped the salary because they were asked to stay in the headquarters, but they did not stay in the headquarters. So that is one of the reasons why the BEO has basically on the advice of the district collector, they have stopped the salary. Now, of course, some of them have gone back and the online education has started, but many of them, like, of course, for that you have provided data, like how many parents have mobile phone, how many people have internet connection, all this information that you have provided. But again, if you had done some field survey and collected some information how things are happening, that would have been really good actually, because in this journal actually we do not have a paper on the education, particularly during COVID-19. But I feel these are missing in your paper, and yeah, so if you can include all these things, then that will probably strengthen your paper. Yeah, that's all I would like to say.
I was just thinking, anyone from the participants would like to make any comment? Maybe, I do not know whether Dr. Nilakant Panigrahi may have something to say. Dr. Panigrahi, Nilakanta Panigrahi, you would like to say something because you may have some field.
By the experts, important. Listening to the ground reality, all they were pointing to the some amount of ground reality functioning paper, that will I agree with
We cannot hear the audio is not very clear, Amarendra.
I think it might be his weak internet connection, sir.
Okay. Yeah.
And maybe I request Professor Chinara if any points she wants to make.
No, sir. I think I agree with whatever has been said, and I don't have anything to add. Thank you, sir.
Okay. So then Professor Naik, you would like to say something more?
No, nothing more. Nothing. I've already said what I had to say. I've already said.
So maybe then we get back to Dr. Kumari. You may have 1 or 2 minutes to respond to this. Dr. Ketki Kumari, you may say something.
Yes, sir.
In the
Yes, sir. I will try to incorporate them and resubmit the paper.
Fine.
Thank you, sir.
Fine. Keshababu, you are muted. Keshababu, you are muted.
Oh, fine. Thanks, Dr. Ketki Kumari. So we move on to the next paper. That is by Lokmudra Behra and Mitali Chinara. It's on COVID-19 and the migrant workers. Please, 15 minutes. Thank you.
Thanks to all and all. A very good known to one and all. Esteemed chairperson of this session, respected sirs, my dear presenter friends, and my dear colleague. I am Lokmudra Behra, lecturer at Pranakrishna Mahavidyalaya, along with the cooperation of Dr. Mitali Chinara, professor at Utkal University, have prepared a paper, namely COVID-19 and migrant workers. First of all, I would like to thank total OEG team to shortlisted our paper to present over here. As we all know, this pandemic has made a critical situation to enter economy as well to the also India. This deadly virus have taken away many lives till dates. Before I start, I would shall I present my screen? Shall I present my screen, sir?
Yes, please.
This is the contents of our paper: introduction, setting, context, objective, methodology, findings, discussion, conclusion, suggestions, and references. As we all know, it is not possible for any government to provide livelihood opportunity to its working age population, which prompts the people to move from their native places to other places in the search of their livelihood. The movement of people across countries and continents is referred as migration. According to the 2011 census, around 140 million out of the 77 million urban population of India have migrated from rural to urban areas. But the COVID-19 crisis has created a very difficult situation. No doubt it has created actually hard situation for entire global population. According to the World Bank report, a projected contraction of world economy by 3% is estimated in the year 2020, whereas this economic recession is continuing well into 2021. This global recession is more prominent in the economy of South Asian countries, whereas the real economic growth is projected to fall by 2.8%, and for the sub-Saharan African countries, the contraction is expected to minus 5.1%. According to the ILO estimates, the job loss has increased by 400% in Africa and South Africa since the first quarter of 2021. In South Asia, 110 million out of 35 million have lost their full-time jobs. Overall, 254 million of full-time jobs have been lost across the globe in the last 3 months of the pandemic. Except the job loss, the migrant workers have suffered due to the starvation, physical exhaustion, and few of them have committed suicide. From the review of the literature, these are the some findings which I have present here. Gurgaon in his paper found that refugees and asylum seekers from low-income countries are among the worst hit by this outbreak. Baldwin in his paper found that by comparing financial crisis with the COVID-19 crisis, revealed that while there was only a demand-side shock during the financial crisis, but this COVID-19 crisis has both supply-side and demand-side shock, which should push the world economy even further backward. The strike in economies like US, UK, Germany, Italy, Japan and China, which constitutes of 60% of world total demand and supply and 65% of world manufacturing, whereas they have the contribution of 41% to world manufacturing, which is come to the halt due to this pandemic. Nicola and others in their paper found that a reduced workforce across all economic sectors is the result of travel restriction, social distancing, and self-isolation caused due to this pandemic. The food sector faced an additional increase in demand due to panic buying and stockpiling of food products. Delayed detection, contact tracing, and band response has resulted in an overburdening of local health system. These findings are found by Khanna and others in their paper. Coming to from this review, we have come to these objectives. Many studies worldwide have tried to focus on the impact of the pandemic on economic growth, output, trade, loss of lives. But this paper has we tried to attempt to see the impact of migration workers who are the unseen as well as the often neglected architect of every structured economy. The objectives of this paper are like to discuss the impact of COVID-19 on the world economy and migration workers, to discuss the impact of COVID-19 on remittance with special focus on South Asian region, to throw the light on the problems faced by the migrant workers due to the COVID-19. The entire discussion is based on secondary data. Tabular, graphical, and method were used to interpret the data. The secondary data are collected from World Bank report, Asian Development Bank, Indonesia, ILO, and World Health Organization, Census of India, and Ministry of Health and Family Welfare. Before we go into the discussion, we know it is well known to all. This pandemic has spread its tentacle all over the globe. By seeing the risk and spread of this virus, the World Health Organization has declared it is the world pandemic. Till now, this deadly virus has taken away 95,916 lives worldwide, whereas 3,094,000 lakh. 3 crore 94 lakh people were suffered due to this disease. Here in this figure, we discuss the confirmed cases and death cases in world most affected countries of the world. Here we see that USA, both in confirmed cases and as well as in death cases, have topped the list. Only in USA, 67 lakh people are suffered from this disease, and around 2 lakh of people are lost their lives in USA. Following USA in confirmed cases, India is the second top and Brazil is the third. Wherein in death cases, following USA, Brazil is the second highest and India is the second. The case for India, it is also very chronic, as it is the second highest cases in active cases and third in the death cases. From this table, from this figure, we can see that Maharashtra is the state which is deadly hardly hit by this pandemic. In active cases, only Maharashtra has 29 lakh 2,91,630 active cases, which is 29% of total Indian active cases, and 32,671 death cases, which is 37% of total death cases in India. Except Maharashtra, states like Andhra Pradesh, Karnataka, Tamil Nadu, Gujarat, and Delhi are hard hit by this pandemic. If you discuss the case of Odisha, in Odisha, 33,504 people are suffered due to this pandemic, and 701 people are lost their lives in Odisha. In Odisha, Ganjam, Khurda, and Cuttack are these districts which are suffered a lot. This is the data which I have accessed in 21 September. Here, this is the forecast of world economy by different institutions. This trend show after 2008-9 financial crisis, the world economy has put a steady situation in this growth trend. But this world pandemic has totally changed the situation. A bad and good calculation made by many of the institutions, that is IMF has previously estimated before pandemic has estimated that is 2.7% growth rate in world economy, whereas by seeing the severity, World Trade Organization, IMF has forecasted minus 4.2% growth rate in the economy, whereas World Trade Organization estimated minus 2.4% in good scenario and in bad minus 8.8%. When we said good, these are the few estimation made by different institutions in the world. We will discuss what is the impact of COVID-19 on different sectors of the economy. From this table, we can see that the sectors like real estate, manufacturing, wholesale, accommodation, and food, which these are the sectors which together constitute of 37% of total world employment, are at high risk. In accommodation and in food services, the sector which is in high risk have constituted 54.1% of women participants. In the these are the sectors which are more labor intensive in nature. The sectors like mining and quarrying, arts, entertainment, transport and storage communication, these are the sectors which need less skilled laborer, which is at medium and high risk also. The sectors which are less affected or in low risk are the education, human health, social work activities, public administration, and defense and utility. These sectors are at low risk, but in this human health and social workers, the sectors which constitute 70.4% of human workers in their total working force population. Following health, education is the second highest sector, which consists of 61.8% of the total employment. Here we discuss the distribution of migrant workers. We discuss the migrant workers in India. Taking the data from census 1991, 2001, 2011, we can here see the interstate and inter-district migration in India. From this figure, we can see that the growth rate in the increase in the inter-district migration is higher than the growth rate in the interstate migration. That is, in the year, the growth rate in the inter-district migration increased from 23% during 1991-2001 to 37% in 2001-2011, whereas the share of inter-district migration grew at 35% between 1991-2001, but the rate of increase, which is 35% in previously, it come to a decline, that is 25% between 2001 and 11. It is due to the people are finding better opportunity closer home than they are before. This shows the Indian migrants preferred destination. According to the International Migration UN report, India leads the world in the terms of number of immigration with 17.5 million of people, which constitute 6.4% of total immigration in the world. The figure shows that most of the Indian migrants preferred USA, UAE, Saudi Arabia as their preferred destination, whereas the Indian migrants share to Pakistan has declined year over the year. It is due to the relationship between India and Pakistan, and except USA and UAE, Saudi Arabia, migrants in India also prefer to migrate to Oman, Canada, and Australia. Here we discuss the highest remittance receiving countries and countries with highest share of remittance to their GDP. As it is known, the remittance have both direct and indirect impacts on shaping the GDP of any country. In indirect way, it increases the effective demand. here we see that in this figure, in the comparing the figure, we can see that India has topped the total remittance coming to the world. India has topped, that is $83 billion, whereas is China and Mexico following path of India. But in share of remittance to GDP, Tonga, Haiti, South Sudan are these countries which are heavily dependent on remittance to increase their GDP or to save their GDP. Tonga have 38% share of remittance to their GDP, whereas Haiti and South Sudan have 37% and 34% to their GDP as remittance. If we talk about the South Asian countries and the share of remittance to GDP, in South Asian country, before you said that India is the top, and also in South Asia, India has topped the list, that is 83.1%. Following India, Pakistan and Bangladesh are these two countries who are earning remittance following India. In the share of GDP, in the share of GDP, Nepal is heavily dependent on remittance, that is 27.3% on remittance to save their GDP. If we comparing the world and South Asia as remittance flow, we can see that in the year 2020, the World Bank has estimated a historic decline in remittance flow to the world. That is 20.
Dr. Baer, you have just 2 minutes, please.
Yes, sir. Only 20%, whereas in India, whereas in South Asia, it is 22% decline. Problems faced by migrant workers. As on the 24th of March, the government of India has declared full-scale nationwide restriction and containment measures. It has mostly halted the migrant workers, which immediately make job loss to the migrant workers. So some of the common problems that migrants face during this pandemic are inadequate access to healthcare facilities. Nation as well as the local government have no precise information regarding the migration in their locality, which makes it almost impossible to include them under the public health care services. Then the second problem is spread of diseases. With the relaxation of lockdown, these migrants started returning to their homeland by special trains and hired buses, and it has resulted in a sudden hike in the number of cases in their home states. Food insecurity. Many of the migrants entrapped in their destination due to the COVID-19 pandemic neither have sufficient savings to see them through and nor have access to the food grains supplied by the government to help the needy people. The public distribution system was not effective to make the food grain available to especially to the migrants, as the ration cards were very area specific. Economic impact. The shutdown of the economy had stopped the production in many centers. Sealing international borders has halted the export and import of goods and services. The world has lost almost 400 million jobs due to COVID-19 pandemic in the second quarter. That is the estimation made by ILO. Whereas around 100 million of more jobs, 100 million and more jobs in India are at risk. Then this is the estimation made by Outlook India. Shift of work and difficult. The current crisis has not only created the difficulty of job loss and rising unemployment, but also the problem of cross-sectoral mobility of workers, which is difficult because the sector which require in this pandemic are the most skilled sector, but it is not sufficient for the
Dr.
Oscar.
Hera, I think your time is up. Maybe just put very quickly to answer.
Yes. I'm going to be conclusion part. These are the schemes PMJQI. And, yes, ma'am.
Slide and so that's all.
Ma'am, conclusion. The COVID-19 pandemic has already taken away 9,106 lives all over the world. The global economy has shrunk by 3%. The Asian Development Bank has estimated 8.8 trillion. World economy loss of world economy, and it is estimated that due to the economic crisis induced by COVID-19, policy suggestion strategy of generating employment on urgent basis, emphasis should be given to rural, agro-based and cottage industries. The agriculture sector can be diversified to produce both food grains as well as commercial crops, build up a robust data based on the migrants. These are the references. Thank you.
Okay, thank you. Thank you, Dr. Vera.
Sorry.
We have a time constraint.
Yes.
Professor Naik. may I request Professor
Vera,
Nayak?
no,
Yes,
yeah.
yes,
Can you hear me now? Can you hear
yes,
me? Yes.
yes,
Yes,
sir.
So very nice presentation of your paper, but
Thank
I
you,
do
sir.
have a few observations.
Yes, sir.
You know, I think the title of your paper has something like migrant labor. Am I right about this? It has
Yes, sir.
migrant labor. Yeah. So my first comment would be this: while listening to your paper, there is a sense that you want to look at the general issue of migrant laborers generally. You are looking at the international situation also. You're looking at the general picture of migration internationally. And you also want to look at the migration situation in India. Uh, it would be desirable to specify and focus on the Indian migrant situation, if this is the relative area of your focus. I mean, then instead of giving a very general picture of the international situation and the Indian situation, etc., whatever your focus area is supposed to be, I presume your focus area presumably is the Indian migrant situation. It would be better and desirable to focus on this particular aspect because that would add value and focus to your particular paper. Now, looking at the migrant labor's problem, it is absolutely clear that there are a whole lot of problems that have to do with their living conditions when they go to leave their home state and go to some other state, their living conditions, the health facilities that are available, uh, if they take their families, what is the condition of their families. All of these are important issues. I don't think you have probably looked at those issues, possibly because of the reason that you want to look at the entire migration picture, on the one hand at the world at large, and then in the Indian condition situation specifically. So my suggestion would be, if you want to have the sort of world situation on migration, by all means include it. You can have a particular section on it, focus on it. But I think probably greater value would be added if you look at the Indian situation on migration, and in particular what we have in the Orissa case. We have a lot of migrant workers leaving Orissa, going to other states, many of whom have returned. I think those are the issues that perhaps you need to at least comment on and focus on. Um, After 2 or 3 months period of the migrant laborers returning, right now there is a situation where some of the migrant laborers want to go back to their original place of work. This is an aspect which we know today, which you possibly did not know when you wrote the paper. So if you look at the newspapers, you see a consideration of what the migrant laborers are doing having returned to Orissa. Many of them are without jobs, and after a period of no work, no income, many of them are now thinking in terms of returning back to their original places of work. So, a focus on this issue, perhaps with the advantage of time, may also be advantageous. It would add value to your paper. So that is all I have to say on your paper.
Okay. And Professor Misra, please.
This paper has given a kind of a more information based from global and country perspective, which is an indirect assessment which has been done as to how did COVID and the economy and the migrant workers getting affected by it. And these assessments are well known, but fact that needs to be highlighted is that this paper can serve two purposes. One is perhaps the tone of the paper should be that the content of information on migrants are lacking in the country at large. Because even if you look at it is the recent controversy in the parliament that the government said we have no data. primary thing is that we had only a intersensal aspect of gauging migration, okay, in the country. Whereas migration, this paper can serve to highlight that there can be alternative basis of recording and collecting and collating information on migration, because that is very crucially important. The second thing that perhaps needs to be highlighted is what is it migration related vulnerability is about. Because not because that people from certain place have moved to certain other place, a large quantum of migrants, they are in kind of informal, insecure sector where actually any vulnerability will hit them the most. Therefore, this paper, another opportunity it has to highlight that what is the conditions and circumstances in which our migrants move and what related vulnerability they do face. Because of this was never realized because of one reason, that there are many people who talked about human rights, working condition and everything else, but one basic thing that was lost out is that do they have a right to be provided for? A migrant is provided for where? Is he entitled to be provided for a destination, or is he entitled to the protection to be provided by the origin? Because this is another issue which needs to be stated. So in summary, I am not saying that you have enough and more information to highlight migrant worker impact of COVID, but take this opportunity on this theme, saying the insufficiency of information. There is a need of alternative ways of information collation on migrant statistics, which is very crucial, that COVID has opened up a new chapter. And second is that why migration related vulnerabilities were not highlighted, except for the fact of wage differentials, they move, except for the fact that the working condition, human rights, all these people were talking earlier about migrant workers. Naturally, it is important that who is the person? The controversy now comes about who caters to a migrant. Is it the destination? Because when we are talking of an emergency like COVID, we are all highlighting state provisioning. We are all highlighting protection that is due to someone. So who will give it? So the identity of the migrant, the right, like perhaps you can quote the very popular and very nice paper called by one of my friend, colleague, Professor Bhagat, Right to the City. Who has the right to the city? Do they have the right? Do they have everything else? So I think we also should take this opportunity not to merely try to make quantitative measurement and impact assessment, but also highlight the need that why insufficiency of migration statistics and what kind of protection, what kind of vulnerabilities that migrants face. Because if you tone the paper like that, it will be relevant for anybody to actually read and get a persuasive idea as to what exactly is lacking in terms of migrant information. We are very much pleased to say that we have intersensal migration information. But just for your record, I must tell that there are many information other than this intersensal information which can give us idea about migration. I can give you a clue to that. For instance, you see in educational institutions, when students are enrolled, you take everything there. Now everything is digital. Am I? Every institution, government, private, semi-government, they are digital. Why is this information not collated to know how many young students, like this happened to not only migrant workers, it happened to students who are studying elsewhere. They also face the wrath of lockdown. So why we could not know? Because this information was not given. That means information exists, which is also not shared and collated because its value was never realized. Therefore, you should talk about it is not merely migrant worker and vulnerability impact, but basically the insufficiency of information on migration. This paper can serve a great deal in terms of highlighting. Thank you very much.
Thank you for Very interesting observations by both Professor Naik and Professor Misra. Amarendra, you want to make any point?
Okay. Uh, One thing that I was thinking, what is the focus of this paper, whether it is international migration or the within the country migration, interstate migration, or it includes both. And then if it is international migration, because since there is a comparison across countries and South Asia, so I thought probably it is focusing on the international migration, and we are talking about the remittances. So in that case, if you can highlight what are the states that are going to be most affected in the country, and where are the destinations, or what are the sources of remittances, from what all countries these remittances were coming, and then again comparing it with the GSTP. Of course, I think that information I don't know whether we'll get that data. Because as far as I understand, Professor Irda Rajan, who has done a lot of studies on this, he says that no, only a few states have done those systematic studies on the volume of say the migration and the amount of remittances they receive. So yeah, that part actually I don't know how we will manage those things, but yeah, these are only my observations.
Anyone from the participants wants to make any comment?
Sir, if I may point out one observation.
Yes, yes, please.
Yeah, sir. So far as the policy prescriptions are concerned, the authors have to check again. It's just an observation that one policy measure was that agriculture diversification too should take place for more commercial crops, etc., like that. So, in this context of your, in the context of your title that you are suggesting, that those policy prescriptions can be, looked at. That is my observation.
Thank you.
Sir, I have one observation. Can I please?
Yeah, please, yeah.
Basing on the last day feedback to my paper, this morning I went to a village. I was inquiring about the migrant labor situation. So I saw that the villagers told that there are a lot of potentiality of observing the migrants and not allowing them to go back. One is creating opportunity under the MGNRAGS. My point to say the role of state in observing, not allowing the migrant to go back is also equally important. Those potential areas, if we can highlight in this paper, that will be an additional policy contribution of the issue of this issue in future, sir. Sir.
Okay. Thank you very much for that comment. Maybe we have just 1 or 2 minutes. I think very interesting points have come up, but I was only thinking if the authors could also look into some of the very recent reports, as I was mentioning yesterday about Professor Ravi Srivastav's very detailed work in which Dr. Balakrishna Padi also has co-authored in that report. And there is a very, very recent report which is sort of the principal author is Professor Babu P. Ramesh of the Ambedkar University in Delhi. That is just sort of kind of a report on migration in South Asia in the COVID context. So I would rather think that it is very important that when we are sort of like contributing papers for a journal like this, there has to be a fairly good reference to the existing and maybe more recent, more relevant literature, which is, I think, a very, very basic. So hopefully, some of the other small point was that maybe I do not know whether when we're talking migrants, we should not be focusing on one or two specific issues like health, for instance, like employment, for instance, or state policy. I think we are sort of at the end. There is a fairly long laundry list of suggestions and recommendations, not necessarily analysis or the data presented in the paper. So it would be good to rethink that. And we can request Dr. Lokmutra Behra if you want to say something, 1 or 2 minutes.
thanks to all the respected members for your valuable suggestion. I will obviously work over it. I have just saying to Pulin sir, sir, in return migration, I have already highlighted the return migrants who are returned back to their destination. I have highlighted, but due to the lack of timing, but I am unable to present here.
Okay, fine.
Thank you. Thank you, all of you.
All right.
Okay, so we move to the next paper before the lunch break. This is a paper by Mukesh Kumar Meena and Megha Sharma. The paper is on the effect of COVID-19 on employment and livelihood. I think Dr. Megha Sharma would present, isn't it? Dr. Megha Sharma, are you there? Dr. Megha Sharma, are you listening, hearing us?
She has to unmute, that's all. I think she's there.
Oh, okay.
Dr. Megha Sharma has to unmute, yes, please.
Sir, she has said that she's unable to unmute herself.
Oh, I see.
She has written in the chat.
Not able to
unmute. Okay.
Maybe the other author can present. No.
Yeah, I think we shift to Dr. Amit Basant Rai, whom I requested. Is it possible, Dr. Basant Rai?
Yeah, if she is not able to unmute herself, I can present my paper now.
I'm joining through the call, she's telling. Just one second.
Yeah, it could be from mobile phone. We can wait for 2 minutes.
We'll wait for please wait for 2 minutes. Okay. Dr. Basant Rai, sorry, I think I made
no problem, sir. No problem.
Because there is a time constraint, so I thought.
जाइनी तो गोटे चालछि गोटे एसोसिएशन जर्नल रो ये चलछि तो रिव्यू में एटा चलछि सेटा अछि कोंतु
Mithali madam is
okay. So if there is some delay, then maybe she can come in the next.
Yes.
I think Dr. Basant Rai, you please start and I'll send a message to her. So, Dr. Basant Rai, please, I think that may save us some time. The paper is on, it is by Ashutosh Pradhan, Rasmita Ray and Amit Kumar Basant Rai. Spread of COVID-19 and policy responses in Odisha, a critical appraisal. Please.
Okay, sir. Good afternoon to all, respected Professor Pulin sir and Professor Uday sir and Professor Keshav Das and President OEA Dr. Amarendra Das. Now, at the outset, I would like to express my I would like to thank you for shortlisting my paper in the upcoming special issue of Odisha Economic Journal. Right. So I'm sharing my PPT. Just to like, is it visible to all of you, sir?
It's visible. It is visible.
Right. So in my topic, you can all see is spread of COVID-19 and policy responses in Odisha, a critical appraisal. Right. So as we are all aware of, this COVID-19 pandemic has turned out to be the greatest humanitarian crisis since the Great Depression of 30s, and a lot of research has already taken up, which has suggested the economic impact and also the non-economic impact of this pandemic, and mostly on economic impact. IMF, ILO, and all these organizations have come up with figures that it could contract Indian economy by 4.5%. Right? It is some have commented that it is the worst economic downturn since the Great Depression, and To counter this the spread of the pandemic, India has had adopted in the month of March a blanket lockdown over the entire country, which kind of affected the laborers or the migrant class most, right? So the some have commented on this aspect of containing the virus, that is the lockdown of the entire economy, that the side effects of a nationwide lockdown were not taken on sound footing, and we have seen the pictures through our TV sets and also in the print media, right? And that migrants walked hundreds of kilometers to reach there, right? So the informal sector was hit hard, and the people who were vulnerable the most, they were affected significantly due to this lockdown. And in the Indian context, since majority of the employment happens in the informal sector, it is approximated by the figure is given by ILO that approximately 400 million workers in India may lose their livelihood and fall into poverty, which is a grave concern for all of us. And majority of the workers that belong to the informal sector were left jobless due to this lockdown, and they were left with no source of income, right? So in this context, Odisha also contributes the migrant labor to the rest of the states. So the migrants of the poorer states of India, like Bihar, Uttar Pradesh, Odisha, West Bengal, Assam, Andhra Pradesh, had no option left but to take the long and unending journey back, right? Odisha experienced a large number of inflow of migrants because of the lockdown. They started to come back to their villages and towns. So by July 30, 2020, a total of 350,401 passengers returned to and these are the figures of the migrants who returned back to Odisha by train, air, and road, right? So in this context, there is a view that due to the mismanagement of this migrant issue, the spread of COVID-19 cases rose significantly. I'm not blaming the migrants, and their entire livelihood options were shut down, and because of which they could not be in their respective places, and they started to flow back, return back to their destinations. And due to that, maybe there is a guess that spread of COVID-19 has taken place to a larger extent. So in this context, I'm looking at, so in this the lockdown announced in Indian context and the inflow of migrants to various states like Odisha, Bihar, Chhattisgarh, etc. So in this context, my main research questions, we looked at these questions like, is the huge inflow of migrants caused increased COVID-19 positive cases in Odisha or not? What is the lockdown and unlock period-wise spread of virus and testings conducted? What are the district-wise figures for positive cases in migrants and case fatality rate? And what are the policy responses in Odisha to check COVID-19 spread? This is just a descriptive kind of analysis just to gauge the situation of spread of COVID-19 in Odisha and the policy responses by the government, by the state government in particular. So we have not used sophisticated techniques, it's just percentages, tabular presentations, etc. And the data sources, as can be seen, most of the data we collected from state dashboard of COVID-19, and other data also. We have also relied upon the published materials in newspapers. Insofar as the policy responses are concerned, we could not go to the ground, but the briefs that were given by government of Odisha by their spokespersons, published materials in the newspapers, and the covid19.odisha.gov.in materials insofar as the policy responses are concerned. So there are two things. We want to first look at the spread of COVID-19, both at all Odisha level and also at the disaggregated district level, and the policy responses that that was announced by the government of Odisha. So I must state here that while writing this paper the positive cases in Odisha, number of positive cases in Odisha were 20,000 roughly. So 3 days back, once this was shortlisted, I wanted to update this paper, and I saw that it is close to roughly 1,80,000 now. So these tables, I'm just showing you for telling you that these are the analysis we want to do, but this needs major updation since we have not taken into account the September figures and also the August figures particularly. So, uh, one point I'm trying to make through this table is that the timing of the lockdown we can question the timing of the lockdown, because in the lockdown we can say the per day infected persons, cumulative total, etc., were not that big. But in the unlock period, the per day infected persons, cumulative total started rising. And also the testing facilities in the lockdown periods were not adequate enough to find out the positive cases, while and after a time gap in the lockdown period particularly, this infrastructure has been set up to test more rigorously. So this needs major updation. So I'm not concluding anything on this on the basis of this figure, because I have to update this table as per the by incorporating the latest data, right? But more or less, it is true that in the unlock periods, the cumulative total per day infection rate, the positive cases, and the number of testings would be very, very high compared to the lockdown period. That puts a huge question mark on the timing of the lockdown. Then on the again this table needs updation, but still we found initially that is the working age population who were affected significantly by the COVID-19 virus, and the male population as compared to the female population, they are also affected. It's we could not go into the disaggregate analysis of these figures. Presented in the COVID-19 dashboard. Similarly, in the district-wise figures, now here we want to find out whether there is any association between migrants, in migrants, and the confirmed cases, and also along with that we wanted to find out the recovery rate and the case fatality rate. Now here I can tell you that although again that point that it needs updation, we found that the districts that are worst affected by COVID-19 virus in Odisha are Ganjam, Khordha, Cuttack, Jajpur, Bhadrak, Baleswar, right, and Moyinbhanj, right? And apart from, and Sundargarh is also most affected. And in all these districts, there is a significant percentage of in-migrants. So if you calculate the district-wide percentage of in-migrants in the total in-migrants of Odisha that had come to Odisha after the lockdown, these districts had a significant percent. For example, Baleswar had 9.8% of total in-migrants. Ganjam had the highest, 12.1% of the in-migrants, right? And if you compare that with the confirmed cases or the positive cases, they are showing a good association. I should have calculated correlation here. I can incorporate that, but there are certain exceptions to this hypothesis that the arrival of in-migrants caused increased positive cases. The exception districts are Gajapati, Baleswar, Jagatsinghpur, Moyinbhanj, Puri, and Bhadrak. These are the districts where this association is not so big. Now let me come back to the policy management. Now the second aspect of the paper is the management of COVID-19, right? Now government of Odisha also focused heavily in the month of April to tackle this migrant situation. So they designed many policies to tackle the in-migrants that came to Odisha, like valid pass, checkpoints, date stamping, standard stickers, Shramik special trains. So those who wanted to come back by road and also by trains, the proper arrangements were made. Then, to contain the virus, pandemic-related information dissemination measures were also taken up. For example, on March 8, Government of Odisha launched a statewide information, education, and communication outreach program. Then, on March 10, government declared COVID-19 to be a disaster and invoked the Disaster Management Act of 2005. Similarly, masks, gloves, sanitizers, essential commodities were declared essential commodity, and a system of maintaining a database of all persons arriving in Odisha from other states was also activated. And this was for the quarantine purposes, right? Then came the tracking, quarantine, testing, and penal action. Then to mobilize resources, the government took certain steps. For example, they mobilized corporate funding for establishment of dedicated COVID-19 hospitals, and they signed various MOUs with 2 private medical colleges, KIT and SOM, for establishment of a combined 1,000-bed dedicated facility for treatment of COVID-19 cases. Then devolution of powers to village sarpanch. This was one of the key measures that was taken by government of Odisha. Now they made village sarpanch as they gave village sarpanch collector powers so that they can contain spread of COVID-19 in their local areas. Then community awareness and proactive villagers measures were taken up. Now, in this context, also IT, citizens engagement, upskilling healthcare personnel, these are the measures that were taken up. Skill mapping of migrants took place also to cater to the needs of particularly Dhamra port. But now that we are hearing the reports that the migrants who came back to Odisha are trying to return back to their original places like Surat, etc., this may pose a challenge to the skill mapping of migrants. So, in conclusion, we can say this. However, I need to see this in the event of the recent data that number of cases are rising sharply in the unlock period in comparison to the lockdown period. The study clearly brings out a pattern that reverse migration caused increased positive cases in Odisha. That means this tackling of in-migration was badly handled. Situation in Ganjam in particular is worsening, and more emphasis is required for this district. Barring Sundargarh, there is a pattern that the neighboring districts starting from Ganjam to Khorda to Cuttack, Jajpur, Bhadrak, Baleswar, and lastly it settles in Boypal. In these districts, the positive cases were higher when we analyzed the data in, I think, August, in July particularly. Then the major challenge before the government is that since March, the health professionals, the municipal bodies, the local panchayat officials are working tirelessly, right? Fatigue of government machineries at both urban and rural centers must be seriously looked into if they want to check the spread of COVID-19. So, thank you. This is my presentation on the topic.
Thank you, Dr. Basantre. You presented on time, and you also helped us in managing time because there are earlier presentations were not ready. Professor Naik, please.
Yes, briefly, it's a good paper, and as you yourself, Dr. Amit Basantre, say, it's a descriptive account of how Orissa has done. So, my only advice would be to bring your data fully as much up to date as is possible and draw your conclusions. I think most of your conclusions you've already drawn and you've talked about it. One thing I would say in by way of a comment and a suggestion, whenever we think in terms of looking at an issue as to whether a state has performed well or not, we ask the question, well, in relation to what? In relation to what? So what we have here in your presentation is that there's no comparative picture as it, no reference point as such. Now, it is true that in the early phase, Orissa certainly was doing very well. It is also true that more recently, there has been some shortfall, which has led to Orissa being a very major hotspot state where the cases are rising. This is certainly happening. So some comment, some assessment of this particular situation would be desirable. But what I was really suggesting is that if you could have one or two comparators, I'm thinking of a state like Kerala, and possibly, it all really depends on the data that you're able to put your hands on. Whether you can put your hands on, I really don't know. If it is too much of a task, maybe you will not be able to do it. But if we are able to compare Orissa vis-a-vis some state like maybe Kerala or maybe Karnataka or some other state, I think that will give us a good picture as to where exactly we did well and where exactly we might have fallen short. I think that's all that I really wanted to say briefly. Otherwise, happy with it. Thank you.
Professor Misra, I think there is some power outage in his locality, but he may come on mobile. Is that right, Amarendra?
Yes, but then he has not yet joined back. So,
Okay, so maybe why not you, Amarendra, because you have also written on this Odisha issue in the early phases in the Ajim Premji University site you had written in the early phases. But any other comments, please, Amarendra?
okay. Again, of course, Amit has rightly pointed out that this is descriptive paper. And then, but again, I was thinking you could have focused on some aspect because you have talked about migration and then management issues. And focus in one table. In one table, you showed the relationship between that have received the uh, number of migrant workers and the fatality rates and then infected cases. Other than that, no, I was thinking uh, like what could be the major focus of the paper. Because see, we have received couple of papers in this journal which are of similar nature. Okay, if you have attended both days, then that would be a problem actually. So just actually, if you provide a description of the major incidents of say the COVID cases and then how the state has handled, probably that would not be sufficient. If you can add some more stories to it, or you can interpret, like Pulin sir was telling that comparing it with other states, and now again, if you go deeper, say probably analyzing it with and linking it with the migrant workers issues. See, within the state, now we see there are certain districts where there are probably no fatalities at all. Okay, and there are some districts where the COVID cases are very high and mortality rates could be probably higher. So if you dig deeper into the data and say if you see again the age-wise distribution of the infected cases and link it with okay, and the gender issues, and probably because those have not been covered in any other paper. So yeah, that would be my suggestion, that if you can still use the updated data and go deeper into the issues, probably that could add value. Yeah, that's all I would like to say.
Anyone from the audience, like on the participants, anyone, because it is on Odisha's responses, so you may have some specific suggestions. Anyone, please, briefly.
See, one basic thing I would like to say is that since we have already produced a report from the association, which has almost covered many aspects. So I would we would basically expect that in a journal, you come with more rigorous analysis of specific issues, so that when people read that, they don't think that these are almost like the same that was discussed in the report. So yeah, that would be probably our expectation.
Yeah. So and Professor Misra is Professor Misra available now, or there is a
no, sir, he has not yet joined. I think you can probably comment.
Okay.
Or if somebody else.
Any other participant wants to say something? In fact, I was from the very beginning, from yesterday onwards, I have been very hopeful that once you have all the authors together and this is around the same theme, let's say broadly COVID issues, I was actually looking forward to some more interaction, but somehow that's not much happening. So that is one's personal choice. But I thought these are the occasions where other contributors also could share their ideas. So still, if anyone wants to say something right now, otherwise, I think maybe we'll get Professor Misra's comments a little later because there is a issue of electricity problem there. My only simple point was, like as Professor Naik was mentioning, that unless we sort of pose this in a comparative perspective, so it is not just enough to either celebrate the Odisha case or to denounce it. Actually. So I think this has to be necessarily in a relative sense. Unless you do that, probably we are not making much sense. This becomes a kind of a story real time. So that is partly. I mean, essentially, it's like as if I'm reading a newspaper on a daily basis or reading somebody's blog. Okay, these are things which happened, but I don't think this adds to the analytical value of it. So I would rather imagine not just comparing with other states within India. In fact, there is a huge literature available on this, which I think many of the presenters have not used. Actually, there is a huge internet sort of information on how other developing countries, how they have responded to this crisis. So unless you make such references to that, our study becomes like as if some data is already available and we are simply presenting. So I thought that was one small issue. And the other issue of I do not know whether you could have actually tried some kind of a causality, like okay, certain like let's say state's expenditure on health, whether it has anything to do with let's say the number of recoveries, for instance, or let's say number of ventilators available, number of ICUs available, and whether it has any links with the low sort of number of deaths in the state. So unless we make any relation of that kind, we are not going to make any contribution to at least in the policy domain. Like now we are more worried about the strategies, what we must be doing from these experiences. And the third thing is, which probably you touched upon, maybe you should, in the context of Odisha, you should actually talk in terms of what are the alternative opportunities of income for instance, like people who came back. So what are the special efforts the state needs to make beyond sort of like talking about migrants per se and their sort of health issues. I think in terms of the livelihood issues, what kind of responses have come or what kind of efforts have been made. And so unless we make some such too many similar studies with us. So Dr. Basantre, maybe you can say something.
Yes, yeah. Okay. Maybe your expectation was to give a kind of cause and effect, and those two points I will take care of. One is the reference point, and the another one is to find out the kind of causality and the something like that. So firstly, let me incorporate the recent data and see what other pictures are coming up, and maybe this reference point I can take care of. And because of the disaggregate age wise infected, that is the aggregate data is available on that dashboard, and the gender wise disaggregate data is not available so far as Odisha is concerned, last time I saw. So I have to see how can I improve that. So the all the suggestions are well taken, and I'll try to work on these comments. That is all I can say.
Okay, thank you, Dr. Basantre, for a very good presentation. Professor Naik, you want to say something or?
No, I don't have anything to say. I think we have given our suggestions. That's fine.
I think we'll get Professor Misra's comments maybe in writing. He would send. So we are just on time for the lunch break. So we get back at 2 o'clock, and
Yes.
I'm hoping Dr. Hudanand Misra should be available by that time. If he's not immediately available, then I would request Dr. Megha Sharma to present at 2 o'clock. But depending on whether Professor Misra is there or not.
Yes, sir. Sir, can you hear me?
Yes.
Yes. We can hear you, Megha. Yes.
Yeah, the problem has been solved. I have joined from the phone. So post lunch, I'll be presenting. Thank you so much, sir.
That is fine. That's fine. Then we can have her at 2 o'clock, even if it is okay.
Yeah.
No problem. Yes, sir. Yes, sir. Thank you so much.
Thank you.